consultant public health physician, as well as the senior lecturer at the Department of Maternal and Child Health at the College of Medicine in the University of Lagos. Dr. Alero Roberts joins us via Skype from Ikoyi in Lagos. Good evening, Dr. Roberts. Thank you for your time.
Thank you very much for having me, Ladi. Nice to see you too.
Interstate travels. The federal authorities had kept this on lockdown for a very, very long time. But now they are opening it up. And from some of the reports we've seen already on the program today, it does appear that in some places, they're kind of prepared, right?
Yes, but let's stop deceiving ourselves. What kind of a lockdown did we have? People had been moving in between, and that is why, I do not see, I fail to understand what the relevance is of opening it up now and allowing all this to go on. The problem that we are having now is that, yes, we're in full-blown community transmission. Yes, now they've opened the state borders and people can travel to and fro. But the very important non-pharmaceutical interventions that we're still insistent should happen, I see no preparation for that. I mean, you showed us the Gombe State bus station, and there's one bucket to provide water, sanitation, and hygiene. That doesn't make much sense.
Given the fact, of course, that this is still early days, the major thing that I suspect that you might also be worried about would be the increase of the already established community spread, with people now being able to move around freely from state to state and possibly raise the spread rate in some of the places where currently it might be a bit lower than in other places.
Well, this is the thing, Ladi. We have to look at the mathematics and the science. The truth of the matter is this is a disease that we know that 80% of people will remain asymptomatic despite being able to spread the virus. However, that means that 20% of people will develop symptoms, some of whom can progress to severe and even critical. When you work out the maths, 20% of 200 million Nigerians is 40 million Nigerians. The truth of the matter is we are just not ready for 40 million Nigerians to develop symptoms that may even progress to severe or critical in a very short space of time. Hence, we have been pushing the mantra of the physical distancing and making sure that people do not keep spreading the virus one to another. I mean, left to me, we should also push the mantra of mask up Nigeria, not just mask up Lagos now, but mask up Nigeria and make sure everybody is wearing a mask. The science has proven the value of masking. If I mask and you mask, we reduce the amount of virus that gets into the community. And then, of course, the hand washing. But you see, government owes us a duty of care to make sure that everybody is able to access safe and effective care. Because at the end of the day, it is clean hands that saves lives. So we are worried about, we know that the numbers are up and they're going to go up way high. If we have the capacity to test, we would see many, many more cases than we are seeing now. The good thing is that 80% of people still remain asymptomatic. But we are not ready for 20% of the people who will develop symptoms that can become severe or even critical.
Unfortunately, Doc, what has been consistent about the figures from the NCDC is that those most affected are those between 31 and 40. Of all the categories, this category has been singularly responsible for most of the cases. Does this worry you?
The working age, these are the hardest working Nigerians that we have. These are the ones that we are depending on for national development. These are the teachers, these are the nurses, these are the front line, the front-facing workers, the bus drivers, these are the traders. So if they are affected, then we have a real problem. And much as we do need to open the economy and whatnot, we must make sure that they are protected by making sure that everybody in that category has access to safe water and can maintain the physical distancing, to mandate people to wear masks may not be that difficult. I mean, if you make it a law, it will become a law. We now all use seat belts in vehicles. So we have to make it a law that everybody must wear a mask. We must make it mandatory. We must apply sanctions when people are seen in public without a mask. But most importantly, we must make sure that there are facilities for people to do the sanitation and hygiene and wash hands. That means that as you are opening the schools, you must have proper hand washing facilities. You must have proper water supply and sanitation and hygiene. You must have toilets that are clean. You must have taps that run. You must have all these things in place before you say you are opening up the economy.
You've touched on a point that I wanted to raise with you, and that is the one of schools. All along, each time people talked about schools, there seemed to have been a almost near unanimity about not opening them because of everything that could entail. But again, we're biting the bullet, so it seems, by saying, okay, those who have to graduate, GSS 3, SS 3, primary 6, could go back. But it doesn't look as if there is unanimity in the level of preparedness or the belief of people in the level of preparedness, even for that.
Have they made the schools safe? Is there a fallback position? If anybody goes to school and gets sick, what is the fallback position? What is the plan? If you're a teacher in that school, what is the plan? You know, there are some schools that will definitely go back, and they'll go back effortlessly. All the really highbrow international schools will have every facility in place, and they can very safely go back. But this furthers the divide between the haves and the have-nots. Those in the lowest strata of the economy, the lowest strata of the society, to have the same opportunities of education and health, then it's very, very unfair. And there are some things that government simply just has to do. You know, yes, we are taking collective responsibility. Yes, communities must do this. But I heard the chairman of the presidential task force this afternoon, and I wondered when he gave an order and said this is the responsibility of the state governors and the LGA chairman to do. You know, you can't give the most important aspect, the most important part of health and education to the weakest arm of government and expect much success. So we have a lot of concerns. What happens when the children get sick in school? Where do we take them? The primary healthcare centers? I mean, these are things that we have to address and things that have to be put in place. And it's not just by merely making a pronouncement from Abuja. We need to see real action on the ground and at the grassroots for us to be able to safely do some of these things that they say we should do.
Thank you very much, Dr. Roberts, Dr. Leo Roberts, joining us from Ikoyi in Lagos. Thank you for your time, Dr. Roberts, and see you again soon.
Thank you for having me, Ladi.